an organisation, rather, a company called WAVE, W-A-V-E. Good morning, David.
Good morning, how are you?
I'm well. David, what's WAVE? What does W-A-V-E stand for?
WAVE is the Well Aging Vision and Engagement Project. So this is a project that is a collaboration between North East Health Wangaratta and La Trobe University, John Richards' initiative. So what we're actually looking at doing through this project is finding out from people in Wangaratta what would be their ideal environment for well aging.
And what sort of outcomes are you looking for?
Well, what we're looking at the moment is, because Wangaratta is going to be one of the highest areas in Victoria with regards to people over 55 in the near future. So we're actually looking at getting a bunch of organisations, community groups and people together to try and work out, well, what do we need to do in Wangaratta to make it the place to age well. So what we're actually looking at doing is sending out as much information as we can and having some community forums and asking a couple of key questions about what would make Wangaratta ideal.
If someone wants to participate in this, what can they do?
Okay, so there will be in the newspaper, and there have been already, there's like a postcard that you can cut out with a reply paid envelope that you can send to La Trobe University, and it simply asks that one question: what would make Wangaratta the ideal location for you to age well?
I believe that part of the questions you ask, you say, do you feel isolated or struggle to get to activities? Do you know what services are available? This is like an awareness campaign for older people?
Yeah, that's part of it, because it also means that we may need to look at ways of developing further services, improve infrastructure, anything like that in the future. Things that might be missing, things that might be not quite there, that we can actually push a little bit further. So if you look at the rural city of Wangaratta, who are also a partner, you look at Gateway Health, who are a partner, the Department of Human Services, who are a partner, and then you look at those organisations and have a look at what they can actually achieve and the contacts and the people that they are in contact with, then we can look at a future in Wangaratta that can be really positive.
So how long is this going to go, this project?
It's an 18-month project, which is the first phase, and then after that there'll be an additional component, which will be the implementation of whatever comes out of the community consultations and the review that we do of the services that are out there.
Will you be in contact with people like people who have retirement villages or anything like that to see whether people are active and who want to be active?
Yeah, so what we'll be doing, there's two major components of it. There's the service area, so all the health professionals and community services and the nursing homes and so on that will be invited to contribute, and then there'll be the community consultations as well, which will be another more extensive review. So that'll be getting groups of people together, sitting around a table, and each bunch should have having a different question to challenge them about what might be the ideal in Wangaratta.
I know a lot of older people are not computer literate, but there is a website, North East Health, all one word, northeasthealth.org.au, which you could look at. But if other people want to get involved in this, can they get in touch with the rural city of Wangaratta or anything like that? If
they get in touch with North East Health Wangaratta, they'll be able to put you through to somebody who can help you out. And if not, have a look in the local newspaper, in the Chronicle, and you'll be able to get the actual postcard out of there. You can cut out and send it in a reply paid envelope back to La Trobe Uni.
All right, David, we've run out of time. I'd love to talk more, because I think elderly people sometimes do feel isolated and would appreciate this kind of help. So congratulations on the project, on the initiative for all people concerned, and let's hope it's a big success.
Thank you very much.